If you've ever had chronic low back pain, you know it is just the worst. It's one of the top reasons people go to the doctor. And for relief, many people turn to a really common procedure, spinal injections. So we're going to dive into this because the story here is probably not what you think. And just to give you an idea of the scale we're talking about, get this. An estimated 9 million of these injections are done every single year in the US alone. That is a massive number. It's become a cornerstone of how we treat back pain. But what if that cornerstone is actually built on some pretty shaky ground? And that really is the heart of the issue, isn't it? What if this super common billion-dollar procedure just isn't recommended for its most common use? We're looking at this huge disconnect between what all the evidence is telling us and what's actually happening in clinics and hospitals every single day. Okay, so let's start with the evidence. And this isn't about some single obscure study. This is about what major leading medical organizations from around the world have all concluded after looking at tons of data on what are called epidural spinal injections, or ESIs. So look at this. What's absolutely wild here is just how much everyone agrees. You've got the American College of Physicians, the big health authority in the UK, even the American Society of Anesthesiologists, and they all say pretty much the same thing. Don't use these injections for routine, chronic, non-specific low back pain. The research is clear on this. It's not some big scientific debate. The evidence just isn't there for long-term benefits. And here's the kicker. It's not just that they don't work that well. There are real downsides. We're talking about things like repeated steroid use potentially weakening your bones. But maybe even bigger is the opportunity cost. Focusing on injections can stop patients from trying treatments that are proven to work, like physical therapy. This is a perfect example of what experts call low-value care, an intervention that costs a whole lot for very little benefit. Which brings us to the central mystery of this whole thing. I mean, if the guidelines are so clear and the benefit is so limited, why are we still doing 9 million of these injections every year? Let's play detective and look at the forces that keep this practice going. First up, and this probably won't surprise you, you have to follow the money. In a lot of healthcare systems, doctors and hospitals get paid based on a fee-for-service model. To put it simply, the more stuff you do, the more money you make. This creates a really powerful financial reason to do more procedures, whether they're the best option or not. Then there's just inertia, Medical training for a long time has focused on doing procedures, and these injections are a big part of training for some specialties. Once something becomes routine, it's just really hard to change course. Old habits, especially in a system as complicated as healthcare, die hard. The whole dynamic between the patient and the doctor is a huge factor too. I mean, when you're in a ton of pain, you want a fix, right? And a procedure with a needle can feel like a really decisive, powerful solution. Doctors can feel this pressure to offer something, and an injection is a very tangible thing they can do for you right then and there. And this right here is such a key part of the problem. Often, the better evidence-based options are actually harder to get. Think about it. Getting into physical therapy might mean high copays, or you have to wait weeks for an appointment, or there just aren't enough PTs in your area. An injection can start to look like the path of least resistance for everyone involved. Okay, so if the problems are money, habits, and barriers in the system, what on earth is the solution? Well, researchers are pushing for this proactive strategy called de-implementation. And the idea isn't to just sit back and hope a bad practice fades away. It's about making a deliberate plan to phase it out. The key word here is purposeful. This is an active, deliberate process. It's about redesigning how we deliver care to get rid of what doesn't work. You can kind of think of it like spring cleaning for healthcare, a really important part of improving quality that honestly has been overlooked for way too long. And de-implementation isn't some one-size-fits-all thing. It's more like a toolkit. You've got options. You could go for full removal, just stop doing it altogether. Or you could replace it with something better, like an immediate referral to physical therapy. You could also try to reduce how often it's used, or maybe restrict it by requiring an extra approval step before it can be scheduled. So that's the what. Now let's talk about the how. The source material lays out a really practical 4-step roadmap for a hospital or a health system to actually put this de-implementation idea into practice. Okay, and this is probably the most important point of the whole strategy. The goal is not just to take something away and leave a vacuum. The goal is to replace the low-value care with high-value care. We're talking about making it easier for patients to get the stuff that we know works, like physical therapy, yoga, mindfulness, and cognitive behavioral therapy. So this roadmap is really a cycle, a loop. It all starts with step 1, identify the overuse. You look at the data. Step 2 is to assess the why. You actually have to talk to doctors and patients to understand the reasons. Step 3 is where you match a strategy to those reasons. And then step 4, and this is crucial, is to monitor what happens and adapt. Are things getting better? Is it easier to get into PT? You have to keep checking. It's a living process. Okay, so let's zoom out and land the plane here. What's the big takeaway? Why does any of this matter? Well, this isn't just about one procedure for back pain. It's really about a fundamental shift in how we think about building a smarter, safer, and more effective healthcare system for everybody. This slide just sums it all up perfectly. We need to move away from this old model of passive treatments and quick procedural fixes, which often have high costs and don't help much in the long run. The goal is to move toward active, evidence-based care that actually empowers people to manage their own health. That's how you get better outcomes and less waste in the system. I mean, this quote from the paper just says it all. De-implementation is not about taking care away from people. It's about upgrading it. It is about finally closing that gap between what we do out of habit and what we know is actually the best option. And that leaves us with one last, really important question to think about. These spinal injections are just one example of a low-value practice that's stuck around for decades. So what else are we doing in medicine? What other routine procedures should we be seriously rethinking?